So Niagara has now entered stage 2 of the province's framework for recovery, and I think that's great news. And it's a sign of all the hard work that all of you have been doing to try to limit the spread of infection here. You've been keeping your distance from others, you've been washing your hands frequently, you've been wearing face coverings when you're going into stores or on transit or places where you can't keep your distance from others. And when you've had any symptoms of illness, you've hopefully been getting tested so we can make sure it's not COVID. And if it is COVID, you've been following up with public health advice to make sure you've isolated and not spreading that infection further. And because so many people in Niagara have done that so diligently, we're fortunately now in stage 2 where a lot more businesses are starting to open up. Of course, another thing that all of us have been doing is we've been staying home as much as possible. And of course, with businesses starting to open up, we of course are expected to start to venture out a little bit more from our homes to take advantage of these businesses, give them some customers so that they can start to actually recover as well. So we have the opportunity to go out and eat on a patio for a restaurant. We'll be able to get our hair cut, which I'm sure many people are looking forward to. We'll be able to go and do some more shopping, and I think this is all great. But I think we also need to be mindful that as much as we've been able to reduce COVID-19, it has not gone away. We're seeing in lots of countries that as they lift their restrictions in society, COVID-19 starts to surge back up. We're particularly seeing it in many states south of the border where they've completely reopened and COVID-19 has surged back. And so what we're doing here in Ontario is we're taking a slow approach to slowly reopen to make sure that we don't see that surge of cases. But the other part to make sure we don't see that surge of cases is we all need to voluntarily keep doing all the things we can do to limit the spread of infection. So that first element of that is that we need to do all of those behaviors we've already been doing. We need to keep our physical distance from others, not get within 2 meters of others so we limit the spread of infection. We need to keep washing our hands often to make sure we're not contaminating surfaces with any infection or contaminating our hands from a surface and then infecting ourselves. Where we can't keep distance, we really should be wearing that face covering so we're protecting others if we're silently carrying infection or from others who might have infection, so we are at least somewhat protected from it. And we, of course, if we do develop symptoms of illness, we should keep making sure we get tested so we can find out where the cases are, follow up with them, isolate them, and stop the chains of infection. So those voluntary measures we do are more important than ever before because we're relying on those more than ever now because we're not going to rely on all the restrictions on business and our economy. But on top of those voluntary measures, I think there's a couple of other things that we really should be mindful of that we're going to do. First off is as much as we're going to be venturing out in public and partaking of businesses, I think we should do it in a way where we're purposeful. So we're not going to just go out and hang outside because we're allowed to, because when we do that, we're adding one more person out there, we're adding to crowds, we're making it more difficult for everybody to physical distance. So I think we should venture out when we have something we want to do. We want to go out and have dinner. We want to go and buy some things in the shop. We want to go get our hair cut or get a personal service done. We have a clear purpose and that's when we should be heading out. But if we don't have that clear purpose, we should be courteous and let others who do have that purpose be able to physically distance without us adding to the crowd by just being outside and hanging outdoors. So I think that's one more important element we need to do. And the final element we, of course, I think need to be doing is really being mindful that with greater risk of infection out there, we need to watch carefully if we have any symptoms of illness. If we do have symptoms of illness, we need to make sure we're isolating ourselves so we're not spreading that illness around, whether it's COVID or something else, which might cause people worry. And we want to, of course, as I said before, call us up in public health, call your healthcare provider, call Niagara Health at their assessment centers and book an appointment to get tested so we can make sure it's not COVID-19. And if it is, we can make sure we limit any further spread of the infection. So that's my big advice going forward in stage 2 of how we're going to remain in stage 2 and hopefully progress soon to stage 3 as well. Keep practicing all of those voluntary measures that have got us this far in stopping the spread of infection. Make sure that if we do venture out, it's for a clear purpose. And watching ourselves very carefully if we have symptoms so we can make sure we get tested if we do start to have symptoms. And if we do that, we'll hopefully be able to move on to stage 3 soon and have even more things opening up.